Dr. Vera Tarman, and I work for Renaissance and Homestead and have been in the field of addictions for some time. And over the course of that time, I've developed this series of lectures on the biology of addiction. So what we're going to do today is, well, first of all, who would be interested in such a talk? I have written or synthesized the material in such a way that my hope is that for people who already know the information, that it's going to be provided in a synthesis so that it's actually practical, useful information in the trenches, as it were. I also hope that I can appeal to people who don't know very much at all about either the brain or about addiction, and will then have a better understanding. So that's either family members or people struggling with addiction themselves. And you know, the end result is to explain why it is that addiction is so strong, so powerful, cunning, baffling, and that it is not a moral failing, but in fact there is biological basis that it's actually a disorder of the brain. And that's what we're going to be talking about today. Although that it is a talk that's being filmed, if you dare, you can certainly ask questions. I'm very happy to take questions. The fellow that's going to be filming might be coming around here, but he's said that he's not going to film anybody in the audience for you know, confidentiality reasons. But as I said, please ask questions if you like. Okay. So the plan for today is, the morning anyway, is the biology of addiction. And how I do this is introduce you to sort of the gross anatomy of the brain, the large parts of the brain, the parts of the brain that are relevant to addiction. And then over the course of the hour, then focus on the microanatomy or the neurology, the neurons, and the neurochemistry of addiction. And the whole point of doing that is to show you the actual dynamic, the fundamental dynamic of addiction itself in the brain. My hope is that once you have that understanding, that's not going to help anybody who's struggling with addiction, that knowledge in and of itself. But what it might do is underline the tools and the techniques that I'll be talking about in part 2, Biology of Recovery, why they work the way they do. So I'm really hoping it'll support some of the stuff that we as clinicians or as people struggling support the behaviors that we may not actually want to do, like meditate when you want to instead do something else. It'll help you, if you have the understanding of this is why I should be doing this, you might be more inclined to do it. But please, if you're here thinking, if I get this, I'll understand addiction and I'll be able to deal with my own addiction, that's not the goal. Knowledge, as we know, is not powerful enough to deal with addiction. Okay, so that's kind of the summary of what we're going to do. And how many of you have been to the first part of this talk, the biology of addiction itself? Can I just see how many people okay, so not too many people. Okay, good. I always start my lectures with questions, really just to provoke thought and sort of get an idea of where people are. So I'm going to start my question with general questions about the brain, because I want to talk about the gross anatomy of the brain, large parts of the brain. So, number 1, the human brain weighs about as much as a donut or a few ounces, 12 cans of pop more than 10 pounds, or a chihuahua 3 to 4 pounds. Now, if anybody's thinking A, definitely that's not the right answer. And if you're thinking B, which oftentimes people will do, they might be thinking about the head and the sort of structure of that, the whole skull. But when we're talking about the brain itself, it's only 3 to 4 pounds. And that's a pretty amazing thing, because it expends energy of like at least 20 to 30% of our energy is the brain, but it's such a small thing. Number 2. Approximately what percentage of the brain is water? 10%, 90%, 75%, 55%. So how many people say 10%, just out of curiosity? And 55%? And 75%? Yeah, okay, so the answer is 75%. If you thought 10%, again, you're wrong. This is not to humiliate anybody here. 10% is actually, if we look at our organs, if we take the lungs are actually 90% water, are the lungs, but 10% not the case at all. 55% is the body in general. Just if you do an overall average of the body, it's 55% water. But the brain itself, 75% is water. Now this third question, kind of related. How much of our brain do we really use? 10%, 75%, 100%? Depends on if we're awake or sleeping. So curiosity here, how many people say 10%? Well, we have quite a few people. And how many people say 75% and 100%? And depends on if we're awake or sleeping. Okay, so the answer is actually C, 100%. Now, if you thought 10%, which is what people typically think, people typically think of it so much so that it's called a science pseudo-fact. It's not a fact, but it's so much believed to be one that it's been incorporated as believing to be one. And you can actually type in the internet 10% myth, and you'll get the story around this. It's been around for about 100 years. But anybody who works in stroke rehab or that kind of area, neurology knows that our brain is working 100%. If it's not working 100% because there's a small tumor somewhere or a scar or something that's happened, then you would know. The neurologist actually is skilled enough to know by looking at your sensory and your motor and your thinking capacity, your language capacity, they would actually be able to say that's exactly where, right there in the brain, that's where there's some kind of damage. But I have this slide here to raise in a really important concept. We're using the brain 100%, but I want to introduce to you the concept of the dimmer switch. The dimmer switch, in order to work, has to be working 100%. It has to have an electrical flow 100%. But we can't actually turn the light on and then the light becomes brighter, or turn the light down. Still working 100%, but it's actually, in a sense, shining more or shining less. And that concept is really useful when we want to understand the brain and we want to understand addiction. Because what we're going to see is that some parts of the brain literally light up like a Christmas tree, and other parts of the brain dim down. The whole brain is working, but one is stronger in a sense than the other. And that's a really important piece. It's become a really relevant piece, especially when we look at the type of science that supports addiction. Then the technology has been looking at things like, how much does our brain actually utilize oxygen when we're doing a particular event, or glucose. And we can actually measure how much of that sugar or oxygen is being used by how light it is and how dark it is. And that's all relatively new technology. So moving on. The right hemisphere of the human brain is the center of musical and artistic creation. And the left hemisphere controls the ability to read, speak, and do mathematical problems. So we're hearing a few truths. Yeah. Okay, and probably the people who are thinking false are the ones who are thinking, well, it's got to be the other way. But that's the idea that we have two parts to our brain. So it's true. Our brain is like a walnut. It's much bigger than a walnut, but it looks like one. You've got two halves with this thick band of tissue in the middle, the corpus callosum, which ties it all together. Each side has its parts that it works on. And in the front part where our thinking is, the right side is the side that's more musical, artistical, and whatnot. And the left side is more analytical. We just like some people are more dominant right-handed and some people are more dominant left-handed, we tend to be more right-brained or more left-brained, or dominance. So to give you an example of that, the left brain type of person, the one who's dominant with the left brain, is the person who's really good at mathematics and abstract thinking likes to have things in like their ducks in a row, like the sequence. I like to have it this way, and then this way, and then this way. Just is really good in terms of language and stuff like that. The right-sided brain, dominant person, is the type of person who likes to kind of look outside of the box. They know the box, the rules, the sequence, but has the capacity to look outside of that or step outside of that, even to the exclusion of really being that careful about the rules. So that would be like the artist who's able to sort of read the nuances of things, or the poet, or the musician. And where we see this kind of research is a lot in education and in career. And so you could ask yourself what kind of jobs. I mean, if you're in a job that you don't like, it might be that you're not in a job that fits your sort of hemisphere dominance. And the kind of person in the left would be like the accountant or the police or somebody like that, and the person in the right, the artist. But it would also be like the therapist, for example, because the therapist or the counselor or even just a good friend is able to hear what somebody says. I hear what you're saying, but intuitively I'm able to step out and, you're not really telling me everything. And they can kind of read between the lines, step outside the box. And so you can see that when we talk about intelligence, there's various forms of intelligence. And, there isn't one type of intelligence. You can be super intelligent in one or in the other. And then there are some of us who are right in the middle. So I want to ask you this question. They did actually, when Einstein died, take his brain out, and they did find a little bit of a dominance in one of his hemispheres. So I'm going to ask you, which hemisphere do you think it was?
Right hemisphere.
Really? I'm not hearing that many lefts. So this is a physicist, and you all know probably that new physics is all about mathematical equations, right? It's understanding the universe in terms of the beauty of a mathematical equation. Huh? But actually, they found that there was a slight dominance in the right side. Well, yeah, you guess you could be, but in his case, there was a slight dominance. And the theory is, at the time when he was around, new physics was already there, that the equations were already there. What he was able to do was sort of step outside the box, because people were really puzzled, well, we got this, but we don't know what to do with it, or we don't know, how far we can go with this. And he was able to take it further, information that was already there, resynthesize it in a different way. And that's an example of right-sided intelligence. Okay. Here's a joke, just to show you an attempt to try to understand right and left side. Here's an example. So I'm going to ask you this joke, and you can determine yourself where you are, if you have any impairment in your right side. So a teenager is being interviewed for a summer job. This is actually based on a scientific study that was done, I think in U of T actually. You'll get $50 a week to start off, says his boss. Then after a month, you'll get a raise to $75 a week. Now select a punchline. I'd like to take the job. When can I start? That's great. I'll come back in a month. Hey, boss, your nose is too big for your face. Now, how many people thought A was funny? How many people thought B was funny? And how many people thought C was funny? There you go. Okay. So who do you think has the right lobe impairment? Would be C. Now, why? I personally, I think C is very funny, but to me, that's slapstick, and it's silliness on that variety. And what the idea is that the left brain, when the right brain is impaired and therefore can't regulate, so that the left brain is, in a sense, more dominant because the right brain is not able to do its job, the person's going to take things very literally. So they won't even really get that. They're just going to see what's in front of them, the concrete, literal, hey, boss, your nose is too big for your face. Whereas the person that is able to take the nuance of the situation and actually step outside the box, which is what humor is taking the actual scenario and stepping and seeing it in a different way, that's right-sided thinking, which in this case the person's not able to do. Okay, so an illustration of that. Now some actual anatomy. What part of the brain is the seat of emotions? The limbic brain, the cerebral cortex, brainstem, frontal lobe. The seat of emotions. How many people say A? And B, C, D. All right, we got some for everybody. Okay, but the people who have been here before were right. It is A, limbic system. And of course, if you don't know what the limbic system is, by the end of the class, by the end of this talk, you will absolutely know what it is, because it's a primary part of the brain when we talk about addiction. So moving to the next question. When you do something you enjoy, like watch a good movie, your what system rewards you? The limbic, the digestive, or the nervous? The most correct answer. How many people say A? B? C? Okay, so the answer is A, but if you said C, you're kind of right, because the limbic is part of the nervous system. But specifically when we're talking about a reward system, something that we enjoy, we're looking at the limbic system. And the digestive system, indirectly, I guess, if you're enjoying a bag of popcorn or something at the same time. But it's the actual enjoying piece that's the limbic system. Okay, number 7. A person with an injury to the frontal lobe may have difficulty A, remembering past events, B, reasoning and making decisions, C, talking, D, walking. So how many people say B? That's the answer. B is the answer. If you thought A, that's closer to the limbic system, midbrain area. The actual reasoning and making decisions is that frontal lobe thinking part of the brain, and the walking and talking is just another part of the brain completely. But the point I want to make about this slide is that this is a different part of the brain than the limbic system. So we have two separate parts of the brain, one that does the thinking and one that does the feeling and the emoting. Start to begin to bring in that idea of that dimmer switch, because that's where it becomes relevant. Okay, number 8, last question. What does a lobotomy involve? Removal of some frontal brain tissue, surgical removal of the emotional midbrain, and cutting off the link between the temporal lobe and the brain stem. If you said C, that would be death, so no, that's definitely not the answer. If you said B, not the answer, but an interesting idea, surgical and removal of the emotional midbrain. We're not at that stage yet of doing anything surgically in that way, although the concept of manipulating the brain from a sort of physical way, like surgery or in that way, was something that was very popular before and may become popular again, but right now we're not really focused on that. The answer is A, removal of some frontal brain tissue. Now, most people have heard of a lobotomy, right? Yeah. And now lobotomies were done in the 1940s and 50s, and they were considered so popular that the fellow who promoted them and did a lot of them and really felt that he was doing a service. I really felt that he was. I mean, so much so that on a weekend, if he was called in, he would say, "I'm going to go because I want to help this guy." He got a Nobel Prize for this, for his work. So what is a frontal lobotomy? What it is they would take a surgical instrument that either looked like some kind of a dental pick or it would have a water spray. You go up the nose or behind the eyes and just scrape a bit of tissue there, essentially causing brain injury in the frontal part of the brain. And that was considered a very effective and useful technique. Now, I guess you could ask why. Why would it be useful? And does anybody want to tell me what do you think would happen if you took somebody who was unruly and disruptive and problematic on your ward in an institutional setting, and if you did this, what would you actually get? Yeah, okay. Well, I've heard somebody say zombie or vegetative state. Well, what you'd certainly do is have the person be a lot less emotional, what we would call a-emotional in psychiatric jargon. And that was perfect for those times, 1940s, 50s, the era of institutionalization. We had institutions that were, now there may be 30 beds, either in a ward or in a residence or something like that at the most. They were thousands. There was one institution that had like 10,000 beds, and that was a big place, but typically hundreds to 1,000. And so you didn't want people being all that disruptive and unruly. And the whole concept of surgical, here's a really old, long before lobotomy days, but the idea of doing something physically manipulative to the brain has been around for a long time. And why would we do that? Because what else could you do? If you are a service provider for people who are suffering from mental illness of some sort, there were no medications. You had to do something physically. So you do kind of bizarre things like this, or alongside with the lobotomies of the 40s, there were also treatments like insulin therapy. Put the person in an insulin shock almost to the point of death, get their sugars down to 2, 1.3, almost to the point of death, and then revive them. And oddly enough, the person felt better when they came out. So, hey, it worked. ECT started around then as well, the sophistication of the machinery then was not that great, but nevertheless, people felt a little better when they came out. So we had these techniques that worked, thankfully in the 1940s, the antidepressants came on the scene, and even the people working in the business of mental health said, thank God. Because it was sometimes, they found it quite difficult to do some of these procedures because some of them didn't necessarily look all that good. The history of mental health is very interesting. So why do I have a slide like this in a talk like this, and why have I spent so much time talking about this? Have you heard the phrase, I'd rather have a bottle in front of me than a frontal lobotomy? You could argue that that little bit of brain injury that was done to make a person not zombie-like, but unemotional, a-emotional, and not able to use their smarts to, that crafty thinking part of the addict in a way, not able to connect those dots so that you could actually do the thing that you were going to do. A person who'd had any kind of frontal lobotomy or who's in a state where their frontal lobe is impaired, i.e. inebriation, is somebody who's very concrete thinking, notices what's right in front of them, can't connect the dots, and is unable to regulate their emotions. I mean, doesn't that sound like a definition of impairment? That's in a way an illustration of how the frontal lobe works and when it doesn't work. Okay. Yes. Oh, sorry, is there a question?
Yes. What's the name of the guy who won the Nobel Prize for lobotomy?
It's Modin, I think. I'll have to check with you because at the moment my thinking capacity is not huge. I have it though. Oh, Moniz, M-O-N-I-Z. That's it. Thank you. Came to me. Now what I want to do is talk about the sort of gross anatomy of the brain itself, and I'm going to give you just the parts that are really relevant. But before I get to that, just to say about the brain itself, it continues to be an area of great question and puzzle. We definitely know less than we know. We definitely, yes. You know what I'm saying here. We definitely don't know as much as we. I don't know how to say this, but you get what I'm saying. What we do know is based really just on the scientific tools that we've had at our disposal. And what we've had at our disposal hasn't been that great. It's been autopsies. You look at somebody who's dead, look at the brain, oh, it's big or it's small, atrophied, so that's what happens. But it's kind of too late for that person. Or you would look at scientific studies of other animals that kind of behaved like us. So we have lots of stuff on dogs and rats and insects to understand our behavior. But it's been in the last 20, 30 years, the decade of the brain, the 1980s and onwards, that the technology has just exploded. And our understanding of the brain has increased tremendously since then. Mainly the technology of today is PET scans, functional MRIs, SPECT scans. These are scans that either enable us to look at the brain and the neurology, but more importantly, they enable us to see when the brain is actually doing something, what room is lighting up and what room is not. So I can actually see when Fred is, George, the guy here, is thinking about Fred, that part of the brain will light up and another part will dim down. So I know that the thinking about Fred is here. And thinking about craving or thinking about addiction, we now know is here and not in another part of the brain. That's been very useful information in the last number of years. Okay, so looking now just at the brain itself, when we look at the brain, we always see pictures generally like this. And you see obviously the eye, nose, mouth here, so there's the structure of the brain. And typically here, the front of the brain, what we call the frontal lobe, and then the middle of the brain and the back of the brain. It's obviously how it's depicted. So that's a 3-pound glob of tissue that is like tofu or a hard-boiled egg. So it's pretty fragile and pretty easy to damage, like really easy to damage.
Pointing at the right side when you were saying that when we have cravings, because that's what it looked like on that puzzle. Is it the right side?
No, I'm going to actually be more specific about where cravings are, but it would be right in the middle there. Yeah, that's actually, in a sense, the focus of the talk is to narrow down to exactly that. So it's a good question. We luckily have the skull to protect us from the elements, like just walking around or something like that, because the brain is so fragile. And the brain has this nice cushion of cerebral spinal fluid along here that nourishes the brain, and also when I do this, I don't bang my head and hurt it. But if you're a hockey player and you banged your head without your helmet or even with your helmet, and that skull and the helmet isn't enough, what happens to this brain? Yeah, we've been seeing a lot of this actually in the press of late, the idea of concussions and the injuries that can occur. First of all, one of the things that has become very clear with all the recent press is that you can actually tear some of the neurological wiring and the connections, and they have to repair themselves again, and that's potentially with scar tissue and all that. Not good news. But there's also just the concept of bruising. If I hurt myself in any place, I'm going to cut myself, maybe a blood vessel will burst. The inflammatory response is going to develop. My body's trying to get rid of the injury, the extra blood and all that kind of stuff. And all the bleeding, essentially what's going to happen is I'm going to get a bump, just like I would on my arm. But and bleeding. But there's no space for it to go here. So it's going to move right into the brain. Not a good thing. I mean, if it's a big enough injury and you've survived it, it could actually push that brain right down into here, which we call coning. Not good. And if you have that kind of an injury, you're out. You've actually passed out. And it's one of the reasons why when people go into an emergency setting, they'll ask the question, did you pass out at all? And it's very important to know that, because if there was any potential that you passed out, then you've had enough of a jiggle to your brain that you've affected the middle part of the brain, which is where our consciousness is, our alertness is regulated. And therefore, you could have one of these potential bruises, bleedings. So when you go to the emerg and they ask you, did you pass out? The next question they'll do if they do an MRI and they don't see anything is they'll give you instructions when you leave to stay awake and make sure that somebody keeps you awake over the course of the 24 hours. Because the idea is that you get that bruising, that bleeding over the course of the day, it's getting bigger and bigger and bigger. You won't know that that's happening because headaches are not a common feature of that. What's a common feature of that? Fatigue, sedation, falling asleep. And how would you know that if you're already asleep? So the brain is very, very fragile physically. And I want to suggest to you that the brain is equally fragile chemically. Okay, so looking at the anatomy itself, we've already alluded to a couple of things. We've got that frontal lobe here, the eyes, nose, mouth here, and then here's the back of the head, and there's our brain. And I just want to situate you to basically the frontal lobe and the limbic system, which is in here, that emotional part. But let me just tell you a little bit about the other parts of the brain and how it works all together. So the frontal lobe we'll be getting at in a few minutes. We have this strip of tissue as part of well, right next to it called the motor cortex. And then right next to it, the pink strip of tissue called the sensory cortex. And they're not really blue and pink or red, but they are specific strips of tissue that have very specific jobs. And the motor is, as you'd think, it governs our ability to move, our motor activities, and the sensory, our sensory activities. And it's very, very specific. So just to give you an example of how specific it is, if you think about this, we've got the ear would be here in the top of the head here. And so just to bring you to that, the ear would be right down. I don't think I can get the thing going. Right down at the bottom here and the top of the head up there. And so if you were to take a probe and push around the ear somewhere, this is actually how they found this information out. They had somebody who was awake doing brain surgery and then took a probe and said, where can you feel this, or where do I see a muscle twitching? You'd actually see it there. So if when they did it by the lips, they found that there was that much area dedicated to the lips, that much area, and that much to the hands, and that much only to the upper arm. So this is the sensory a part of the cortex. So what we're looking here at is essentially what you can feel. So this is why you would give a needle here rather than in the finger. And a diabetic knows that that hurts. You much prefer to do it here. And you know, you could ask the question biologically, why do we have so much of our brain that is given to the lips and the mouth? You think about this, we are biological animals that just happen to think, and being able to detect what kind of food you're eating and what it tastes like and what it smells like are crucial to our survival. So this has got a lot. And similarly, our ability to use our hands in the way that we have. Now this is a good slide also to point out a concept that we call neuroplasticity. Because if the brain is very specific, as I've mentioned, but if for some reason I lose the power of my eyes, because for some reason I've damaged my eyes, I don't need this anymore. But I'm going to need to be able to feel even more than I can now. So I'm going to actually borrow some real estate from the eye that I don't need anymore, and so that I can actually feel things better than I could before. Of course, so the concept of neuroplasticity is that the brain, although it may not actually be able to regenerate, it can certainly relearn by resynthesizing, taking up new territory, and building stronger connections than it did. But for that process to happen, the person actually has to do it. So they can't think it, they have to actually do it. So because thinking it is another part of the brain that's got nothing to do with the motor cortex. But doing it and actually feeling it in this case, the more that happens, the more those connections are made. So it raises the connection or the point that people make about how sometimes you have to act yourself into behaviors. You can't think them because it's a different part of the brain. And the more you act them, the more they become natural. The connections actually are made. So that's really important with stroke patients, for example, and it's very important with addiction, as I hope to show you later. Okay, so here just to show you the comparison, this one is the motor cortex. It's pretty much the same as the sensory one, the mouth there. So we have a big area for our lips either to talk or to eat. Okay. Oh, just to go back, so just to finish up. So we've looked at those two parts. Then we look here. This is called the parietal lobe back here. And the parietal lobe is part of what helps us take in the sensations, like the warmth of the room or the colors of the room or the sounds. And then it helps me situate it into something that makes sense to me, so that I know that I'm here and you're over there. And I guess, in a way, a sense of boundary making. And people have even wondered if that sense of boundary making can apply not just to physical boundaries, but emotional boundaries too, just a sense of boundaries. When this is impaired, that parietal lobe, that's that, like through a drug, that's when you have that sense of, I'm one with everything. When you're doing a meditation and you close your eyes, cut off the sensations of here I am and there you are, and I'm not paying attention to those cues, then this will diminish, and I'll have that sense of oneness that you get when you're in a meditation, sort of that universality that people want. People have even talked about how, is this when you have a near-death experience? Is it lack of oxygen in this parietal lobe that's starting to give you that experience? Almost as if, as the person is dying, some parts of the brain are mobilizing because there's only so much oxygen and sugar. You want to go to where it's important, and the parietal lobe is not that important, so it's going to go. And so you're going to have that sense of, I'm no longer here, but that shining white light sensation, it may well be because another part of the brain is highlighted, and to the exclusion of the parietal lobe. And here we've got the occipital lobe, and that's the part of the brain that helps me to register vision. So I can, if I don't have this working, I mean, I have all sorts of lights coming in and sensations of vision that go to the rods and cones of my retina, but that doesn't make any sense until I have the occipital lobe that makes it a picture, into a picture that I understand. If I close my eyes and I don't see light anymore, I don't see any sensations, and imagine a beach, this will be lit up, the occipital lobe, still working. If this has been damaged, presumably I wouldn't be able to even see in my mind, like sort of my mind's eye kind of thing. Wouldn't be able to see. Now, we have a concept that's called blind sight. And have you ever had that experience where you had a sense that something was coming at you, but you didn't see it, but you still moved? And that's an example of how you can see, even though you don't register and see the picture here, but you're actually still seeing it and reacting. Blind sight is where the vision is just at the front part of the brain, but not including this. So they actually took patients that were blind because of the occipital lobe. They had vision coming but couldn't make sense of it. And threw a ball at them, and at more than half the time they would move out of the way. And they even got them to be able to catch the ball. And they'd say, "Can you see the ball?" "No, I can't." But they were able to catch it. Because we have a sort of almost a reptilian lower animal response. A vision comes in here and clicks in here in terms of fear and safety, and we respond without even seeing it. So kind of to show you that these are the sophisticated parts of our brain, but we have something else going on here that doesn't actually require all of this. So we're just moving into that concept. Now, last part of the brain is the cerebellum that I want to talk about. And the cerebellum is the oldest part of the brain, and it's the part of the brain that, amongst things that we probably don't even know what it does, is it enables us to coordinate our movement. So I need this part of my brain to move, but this is the part of my brain that allows me to coordinate my movement so I can do that. You know, I can walk in a straight line. And when you see somebody do something like this, what does that remind you of? Like a field sobriety test, a test on the field measuring to determine if you're impaired. And the reason why something like a field sobriety test is still very important and useful is even though you might have a blood alcohol level, you're thinking somebody's impaired, and you might have a blood alcohol level of 0, but the person is not able to pass this test, you know that they're inebriated. We know that, for example, with alcohol, that inebriation or the effect of alcohol lasts 20 to 30 hours, long after the blood alcohol is negative. And how would you actually be able to document that unless you had some kind of test to measure brain function as opposed to blood? Because you could almost argue that a blood alcohol level is a measure both of alcohol consumption and the excellent state of a person's liver, but not actually impairment. The impairment would be doing something where you can actually measure function like a person's ability to walk. Okay, so that's the general sort of synopsis of the brain in terms of the anatomy that I want to talk about. Now I want to just move to a slightly different way of seeing the brain, which is the concepts, the functionality, the concept of functionality. And this is a very simplistic way to see the brain, but it's a very useful way to start, and then you can build on it. People have often talked about the brain as being like a tripart brain. It's almost like 3 separate brains that are working together. And you can almost see it on a chronological level. It's 3 separate brains working together. So the first part of the brain, I just imagine here the brain stem. I ask you to imagine a mushroom. So you've got the stem of the mushroom, and that would be like the brain stem. And then the tip of the stem of the mushroom, the midbrain. And then the top, the cap of the mushroom, the cortex. So the stem of the mushroom, its job is, it's almost like they're all fundamentally different jobs, but they all complement each other. So the stem of the mushroom is all about life itself. So this is not about thinking about life or reading books or anything like this. This is just life. It regulates my body. So my body's underneath here because there's my head and my brain. Underneath here, I've got my stomach and my lungs and all the rest of that. But up here, this regulates that. So if I want to breathe, my lungs will do the breathing, but this tells me time to take a deep breath. Or no, you've had too much oxygen, don't take a deep breath. This actually takes the oxygen and the carbon dioxide that's in the blood, and at some point triggers in and says, okay, Vera, take a deep breath. So if this is something wrong with this, even if my lungs are in perfect shape, I'm not going to take a deep breath, and then I'll die. That's the brain stem. So, and the digestive system is the same. If I'm very stressed, this will regulate my digestive system. If I'm very stressed, for example, really anxious, it's going to make my digestive system work faster, and therefore have got to go to the bathroom or have diarrhea or something like that. That's this. Even though there's nothing in my body that says you have to get rid of this, because there's no poison or something. But this will tell me there's stress, there's threat, therefore evacuate and get rid of it. That's what this is. So this is like it's the body controls, in a sense. Then this part of the brain here The emotional part of the brain, midbrain, is all about making sure that I do to support this. That's all this is about. So when we talk about the brain, or the biology of addiction, or the biology of anything, we always think of it as we are animals that just happen to think. And my animal prerogative is to be alive and to spread my DNA. Like that's the goal. Anything else is not, it's gravy, it's not that important. So my emotions are all about making sure that I do things that keep me alive. I get angry so that I can protect myself. I get afraid so I run away. I get happy, so that tells me that I'm doing something that is in some way survivally, is benefiting my survival. I get anxious similarly to get away from a noxious stimulus, something that's dangerous to me. Our emotions are there to make the multiple stimulation in the world, I can't pay attention to it all, to focus the relevance of whatever is happening to me in my life. That's why we have emotions. And by the way, that's why we don't want to get rid of emotions. We don't really want to wipe them out, because they are actually triggers or signals for us to pay attention. Something is going on here that I should be attending to fix. Okay, and then this part of the brain, the cortex, the thinking capacity, it's the cap of the mushroom. This is the part of the brain that its job is, it's the most newly evolved, to support the emotional, which is supporting the body, the biological bodily functions. So I'm going to give you an example to illustrate what I mean. So here, this will regulate my digestive system, so that if I have food, it'll make the process happen so that I can process the food. This will make me have hunger. Because if I'm not hungry, then and hunger hurts. So the hurt of hunger will make me eat. Or the pleasure of food, and we tend to desire energy-dense foods. Now, the brain is not going energy-dense, sugar, dangerous. It's going energy-dense, great. That's a lot of sugar. That's in terms of the brain technology is great. So that's why we desire. That's why we like sweets. They're very energy dense. So pleasure or pain is here to make sure that this is working. And then this up here is, okay, I really like the idea. I'm hungry and I want to eat something and I like this food, but last time when I ate all of it, I got sick. So you know what? I'm remembering the past. I'm thinking about the future. I'm going to just have this much and save the rest. So it's the ability to think out, sort of into the future, into the past, and actually tie together a pattern of behavior that regulates this, which is I want to eat it all right now. That part of the brain there. Okay. Now, when we talk about addiction, I've already mentioned that dimmer switch, which I want to bring back here. And I want to remind you, these are all three separate parts of the brain, each with their own function, as it were. And it is not uncommon to have the dimmer switch light up here and not light up here. And in fact, we're wired that way. So in order of importance, this is the most important, because I'm an animal and I need to be alive. Then this, and then this. So the illustration I always like to use is I'm walking across the street on a busy day. I've got my coffee in one hand and my music playing, you know, on my iPhone or something like that. There's a lot of cars coming. There's just far too much stimulation for me to actually notice everything. But I notice the coffee because it's warm and it's nourishing to some degree. I notice the music because it's pleasing and it's reminding me of a fond memory, which is probably some social connection somewhere that's positive. I'm noticing the cars, but only what I need to. And then a car comes sort of out of the blue, and I just sort of notice it, and then all of a sudden I really notice it because it's coming right at me. And when I kind of register that car is going to hit me, then I get out of the way. I jump. So this has to be here to protect me for this. But if this were too strong, if this were stronger, then what we would end up having is somebody saying, that car is coming at me, and you know what, it's my right of way, and I think I'm going to argue this. I'm dead. Or, I really like that car, I got to get that guy's name. Dead. So this is actually not, we don't want this to be more powerful than this, and it's wired so that this is more powerful than this. That's just the way it is. Evolutionary-wise, we can look at animals and we see that most animals have this. Some animals, I mean, like, I guess a grasshopper will have this. I don't think there's a lot that a grasshopper has in terms of emotions, but my dog probably has more emotions than a grasshopper. And then up here, fewer animals have this. So I don't think a grasshopper has very much of this at all. Or a bird, we call it bird brain because it's so tiny. It's very little of this. So evolutionary-wise, mankind has sort of the biggest hold on this one. But all creatures have this because we are essentially all biological creatures. And you could even see this in terms of human development. Human development, the first trimester, it's all about this. And then moving through into the actual, up to the delivery process, we've got more of this and some of this. But most of our core textual development happens after birth, or a significant a portion of it. And I'm going to ask you a question. So one part of it would be in the first year to two. And that's the time when a person is, the baby is learning how to walk and talk and stand and recognize people. And it's pretty phenomenal things, right? So the brain is having to make all those connections, which, by the way, is why a baby sleeps a lot of the time, because most of those connections are made in REM sleep right at that time. So if a baby is sleeping all the time, good, let them. And when is the other time? Which also requires a lot of sleeping. When is the other time in human development? Yes? Adolescence, that's right. And again, requiring a lot of sleeping time. And the type of intelligence or core textual development that happens in adolescence is, I don't know if it's as important as in infancy, but it's pretty important. It's not how to use language and how to talk and walk. It's how to use those finer things like judgment, having insight into yourself. How do I feel? What are my feelings? How do you feel and what are your feelings? Recognition that there is another person in the room besides me. Recognition of boundaries, that would be an example of that. Recognition of risks, a sort of sense of judgment. I can do this, but I have to stop here. And we know that teenagers are often, that's a high-risk time. People are using their, testing their risks. But in fact, they should be. That's the whole point. And a really good concept of parenting would be not to allow no risk, but to allow safe risk. And if a person says to a teenager, why do you do these stupid things? It would be kind of like saying to a baby, why do you keep falling? Because they have to learn how to walk. And that's exactly what's happening in that time of life as well, is they're learning how to do these things. And so the idea is not to not do them, but to do them in a safe context. Now, here's where we can ask a question. That's the sort of finer frontal lobe development that's happening in the second phase of life. And people say teenager, and some people have even said even longer, even up to 30. It's not even just teenagerhood. It can go even longer than that. But you could ask the question, when is it that people typically start using drugs and alcohol? When they're teenagers. And suddenly we got loud. If the teenager has consistently used, which I see happening all the time with our patients and our clients, there are some people who have consistently used from the age of 14, and I say, have you ever been sober at all since then? I say, not really. If it wasn't one substance, it was another, and it was another. And just think about how much time was spent doing this, because that is the part of the brain that is impaired when you're high. So people will often say when they come into recovery, I feel like I'm just 13 years old. And probably a level of maturity is because they haven't spent that window period of time to develop that maturity that was meant to be during teenagehood. And you have to do it now. But that would explain why that happens. So we've got this sort of human developmental thing as well. But point I really want to end with on this slide is that we've got 3 separate parts of the brain. And in order of importance, it's the brainstem, midbrain, and then the cortex, all the way up. So let's we've got the cortex here. Now what I want to do is just talk about the cortex in a way and get rid of it. I mean, let's just talk about it and then put it away, because really what we are the most interested in is that middle part of the brain, the emotional part, because that's where addiction is. And because the point I want to make about the frontal lobe and the thinking part of the brain is it is the least important part of the brain, so let's not spend that much time on it. If you crack open a skull, you'll see the brain. That's what it looks like. And it's all scrunched like that because, in fact, over human development, human evolution, the cortex is has grown the most. It has grown exponentially over time. And could ask the question, does a bigger brain mean more intelligence? Does size matter when it comes to the brain? So how many people would say yes, a bigger brain does mean more intelligence? Okay. And how many people would say no? Okay. So in a way, you're both right. The initial question, just bigger brain itself, does that matter? No, it doesn't. An elephant is 4 times the size of our brain, but an elephant is more than 4 times bigger than me. So it has a lot more brain focused on sensory and motor, because it's got to move a lot more and feel a lot more than I do or you do. But what is bigger is the frontal lobe, this part here. And in a way, you could argue that that's the measure of intelligence for humans, is this frontal lobe here. This thing that drugs and alcohol, by the way, impair. This here. A chimpanzee ape, which is about as and is the closest in terms of biology intelligence to us, has about 13% frontal lobe, which is this blue. Not really blue, but just to see the distinction there. 13%. That's the closest that we have to us in terms of intelligence. Chimpanzee ape can almost say words. It could string a sentence of 3 words together. We have 44% frontal lobe, significantly more, and that's where our intelligence is and where a lot of our human development in terms of over time evolution has developed, is in that frontal lobe. It's been even postulated that so much of this is developed the more we become social, the more or maybe the most recent frontier is our social connectedness, from isolated creatures to being hyper-connected, thanks to this social piece. Again, if you want to think drugs, alcohol impair this, what do you feel when you're using out there alone, because this part is not being utilized? Anyway, we'll get to that more later. Okay, so that frontal lobe that I'm talking about, let's start to relate this to alcohol. Is responsible for intuiting the negative effects of drug use, experiencing the euphoric effects of drugs, or utilizing the recovery tools based on foresight and judgment that can control. Okay, so the answer is C. Frontal lobe is responsible for that foresight and judgment, that thinking into the future, thinking into the past, that will control or regulate cravings, or you could even just scratch that word and put emotions. This part of the brain here, the experiencing the euphoric effects and the intuiting of the negative, not the thinking, just that sense of it, is the limbic system. And here's where I want to really start to show the distinction that you can have this happening and this happening at the same time, and they may be diametrically opposed. In fact, that's what happens in addiction. Two separate parts of the brain. And just I want to bring this point out about substitution. Using alcohol to avoid another drug of choice, or drinking alcohol to increase the effects of a second drug of choice. What does substitution mean? That's right. Substitution is using one substance to avoid another substance. And does that work? But I bet you a lot of people think that it did, or at one point in their life, thought that it did. The reason why it doesn't work is, even if we don't even think about the substance itself, the reason why it doesn't work is that that frontal lobe cortex, where all the recovery tool all that ability to say yes and no and maybe this or maybe not, is disabled whenever the mind is altered by any drug. Any drug. I mean, we're not even talking about the neurochemistry yet, where I can actually show you that one drug looks like another drug in the brain, looks the same to the brain. Now we're just talking about the fact that when that frontal lobe is disabled, it can be disabled with any drug at all. In fact, it is so fragile that it can be disabled even with strong emotion. You don't even need to put a substance. It's just strong emotion. And I want to give you an example of a strong emotion that will disable the frontal lobe. Have you ever been so anxious? Now, you've studied for the test. I think about myself in a driving test. I've studied, but I failed 2 of them already, so I'm nervous. And the moment I get into that car and the person looks at me, I'm remembering I failed 2 of them. And even though I have learned all the moves, what happens? Blank out. Blank out. Now, do I not have that information? Of course I do. It's there. But what happened is the light has turned on in that fearful place, and that intellectual part of me that is going, no, you know how to make those moves, you know how to do that, is that light is turned down, and I cannot access it. I might be thinking somewhere, no, I sort of know if I just do it. What was it? Like when that person asked me what the name of the clinician was. I knew it, but I couldn't get it right at that moment. It's there, but it's not, because the light was not on in that part, because it's on in another part. Another example, person is so angry that they're going to do something, and they know they should not do it. I'm going to swear, but I don't want to, but I know I will. No, I don't want to. I know what's going to happen, but I do anyway, and I do. Because that part of the brain suddenly has taken over in such a way that no matter how reasonable I become, I can't control that. And I actually just read something recently about swearing, cursing, that cursing actually has a neurochemical reward factor. It actually gives you a sense of endorphin release. So the reason why when you bang your toe, you swear, because it actually gives you a little bit of like a Tylenol or something like that, a little bit of something. And people who are used to that, because they swear all the time, are going to have to swear a lot more to get that same effect. And they were even postulating in this research that that the people who are asked then not to swear have to go through withdrawal. Like, I don't feel good, because they want to have that feeling. So it really doesn't matter what it is. So idea here is that frontal lobe, you know you shouldn't do it, but if the other limbic system takes over, that's the key. So we're going to break, but what I want to show you just to let you know what we're going to be talking about is, so far what I've talked about is the general anatomy of the brain that's relevant, frontal lobe, limbic system primarily. importance of the frontal lobe, what it does, but the key piece is the limbic system. That's the emotional piece, and that's the piece that we want to understand if we want to understand the biology of addiction. Now, in break, somebody told me, I had a question, a little scenario about a friend of his, and I thought, with his permission, if I could repeat that, because it was a really nice way to summarize what I've done in the morning, talked about so far. He said he had a friend who had an alcoholic seizure that became an alcoholic coma because he drank so much, and that now his brain is, quote, flatlined. It is, unfortunately for him, but I guess for us it's a really useful illustration of what happens with alcohol and how the brain actually works in the way that I've been talking about. When you have one drink or two, what's happening is the top part of the brain, the cortex, gets affected. The thinking, you become numb to your thoughts. You're not really thinking of them anymore, or they're kind of fuzzy, not so clear. You have a few more drinks and the emotional numbing starts to happen, or the pleasant feeling starts to happen, or a little bit of is happening at the same time. You keep drinking and drinking and drinking, and eventually this starts to happen. And if the poison, the toxin of alcohol actually gets to this point, then I am no longer telling myself to take a deep breath. Even though I could breathe, I'm not telling myself to take a deep breath, and then therefore I stop breathing and then I die. When a person is drinking, the process of inebriation is essentially the slow process to coma and death. Essentially what's happening. You could argue, and this is something that I often like to throw out as if you hadn't thought about this, think about it, that the grape. Where does alcohol come from? The grape, basically, fruits and vegetables of various sorts, and sometimes wood. How do they, as biological things, protect themselves? I mean, they can't fight me, they can't kick me and throttle me or whatever, but they can poison me. So that when I eat them, I become so intoxicated that I'm unable to eat more, or I can actually die. So it's sort of nature's way to protect these things, and I'm essentially ingesting a poison in that process. So if you argue if it's natural, therefore it's healthy, not necessarily, which we hear quite a lot in the rooms, I'm sure you know. Okay, so that poor fellow, brain dead or flat lining, essentially what's happening is this is the only thing that's working now, but all this is no longer working because the alcohol, he drank enough that he essentially caused brain injury to this, and then if he kept drinking, would have not been able to breathe and then would have died, which is what we call an alcohol overdose. So that's, in a sense, what we've talked about so far. So now, I want to talk about the second part of the lecture is to talk about the limbic system, the emotional brain, the middle part of the mushroom, and its importance. So just to situate you again, the middle part of the brain, that's right in here. There's the cortex, the thinking part of the brain, that part of the brain that makes me different than my animal, my dog, for example. And then here is that middle part of the brain. That's what we're talking about, the limbic system. And in understanding the limbic system, you're going to understand moods, mood behavior. So, for example, anxiety, depression, bipolar, all that stuff is all a disorder in here. You could argue that it's also a disorder of this, not being able to regulate this. But this is where the juice is, really. So you're going to understand mood, and you're going to understand addiction, because addiction is here as well. This is the piece that we really want to understand, limbic system. So 2 functions of the limbic system. I'm going to start with the emotions, and then we'll talk about the reward factor. The first one is it generates emotions. You can almost see it as the pain and the pleasure distinction. So we're going to talk about the pain first. Because the non-painful emotions, we are animals that happen to think. And my default mode is to be sensitized more to pain than anything else, or fear. So if you say, you know, why is it that I always wake up slightly anxious or fearful? Well, we are animals, and we are almost primed to be always on guard. I mean, look at how fragile I am to the saber-toothed tiger. I want to have a sort of an awareness of my sense of danger, which translates to a feeling of anxiety. When we talk about the goal of serenity, I'll be talking about this in part 2, it's not to not feel these feelings, it's to know how to recognize them and moderate them so that they don't dominate. But the essential emotion that we have by default is fear, anger, that sort of thing. And then the more sophisticated emotions like happiness and contentment and social are all accessible to us, but they're in a sense more sophisticated. And we need to have our frontal lobe in a communication between frontal lobe and limbic system fully operational to be feeling serene in the way that we want. So sort of base emotions in the limbic system, fear, anger, that sort of thing. Excuse me. If you're interested in anatomy at all, then the thing you want to remember about the limbic system is the organ that we call the amygdala. The amygdala is like our emotional charge button. You see something, push the charge button, car is coming, okay. It starts off the fight, flight, freeze response. The adrenaline surge. It's actually called the 4 Fs. There's the fight, flight, freeze, and then the other F, I'm going to let you figure that one out yourself. But it's the adrenaline response, and it's that middle part of the brain. Now, how it actually works, you have a child who sees something there, and you get the stimulation is going to the brain. And remember that blind sight? Even before it goes to this part of the brain and the thinking, it's going directly to this amygdala. And then right next to the amygdala, we have the pituitary gland. We have other glands that actually will kick in that fight, flight, freeze response. They're like right next to each other. And that will happen immediately. And then seconds later, it twigs up here. Intentionally. Remember, the car is coming. I don't want to be thinking, oh, well, you know, what kind of car is that? I want to get out of the way. I'm wired to protect myself first. So this piece here, you could argue, the fact that we're actually wired this way, because we are animals, is when we talk about, human frailty, human weakness. I'm a nice person, but sometimes I blow up at people. I'm an intelligent person, but sometimes I'm anxious and then I'm really stupid. All that kind of, the kind of human frailty, human weakness, human nature is this, that this here is actually more powerful than my thinking capacity by virtually a few seconds. Child sees something and gets frightened. Oh my God, it's dark. They're in the basement. They see a shadow. It's a rat. I don't know what it is. Oh, it's just my cat. Okay, it's just my cat. But in the meantime, this is already flooded. The child their pupils are big, their mouth is dry, their muscles are tense, and their thinking has been mobilized. The blood has been mobilized to this part of the brain. I got to save my life right now, type of thinking. And then this will kick in. No, it's okay, you're okay, but this has already happened. This is way more important than this, as you can see, even biologically, chronologically, we hit this first and then this, and it's so important. Do I have the picture here? Yeah, there we go. Well, let me just point out here that I just mentioned that a whole bunch of things happen with the adrenaline response. Our thinking also becomes mobilized to, I've got to save my life. And I don't want to be thinking about my taxes or about the guy's car. I want to be thinking, get out of the way, save my life. And this type of thinking is, see if you recognize this. It's all about me. It's got to be right now. Not in 20 minutes or in an hour or whatever, but right now. It has to happen. It has to happen. or else I'll die. If you ever have that kind of thinking, if you can recognize that kind of type of thinking, that is an amygdala or a limbic system response. And it is, we all have that, and we're actually primed to go there first. So the trick in recovery is not to not expect this to happen, it's to expect it to happen, and first of all, try not to get into a situation where it does happen, and here we talk about recovery techniques like people, places, things. Let's not get into a situation where that's going to happen. And then secondly, to recognize it does happen, and this is what I do. Because I can't not say, don't act this way, don't, you know, if someone says to you, calm down, relax, chill. I mean, how well does that work? It doesn't work. You actually have to apply other techniques to try to get to this here. And when we want to try to weave 12-step thinking into this, I like to see this as, this is step one right here. I am powerless over this phenomena, that this is actually stronger than this or faster than this. That's already at the get-go, even without the addiction. Just by virtue of the fact that I've been born and signed up as a human being, I am powerless over this. So when we talk about 12 steps, it works for alcoholism, addiction, and it works for just emotions, moods, behaviors, you know, mental disorders of any sort. Just being alive, I'm powerless over this fact. And emotional maturity is not don't get upset, but what do I do when I'm upset? What are the tools that I have at my disposal? Okay, so point out here that higher cortex thinking, it's a delayed reaction. Hence, we're left with stupid thinking, that middle part of the brain. And that smart thinking, don't do that thing, don't tell the pharmacist what you really think of him, Vera. That part is just not as powerful as the, I am going to tell this guy how wrong he is. And my writing is very legible. Okay. Here is, just to show you the real distinction of what we're working with here. That's the limbic system, and that's the frontal lobe up there. The frontal lobe up there, his job, think about it, he's smarter than the elephant. He can see into the future. He's up higher. He can see, you know, there's the food over there, and you don't want the elephant to eat too much. And, you know, make sure that the elephant has got lots of friends around, and it's not cold, and it doesn't get angry. We got that, the acronym HALT, hungry, angry, lonely, tired. That's the job of the frontal lobe. Make sure that I'm not hungry, angry, lonely, tired, because if I am, that means I'm not doing my job. And what happens then? This guy loses his job. Because if I'm hungry, angry, lonely, tired, I'm at risk, I'm in danger, and I've got to save my life. This is the guy who's telling me to you know, stop and challenge the guy who's about to hit me. Excuse me, get out of my way, I got to save my life. And this will take over. That is moods, emotions, and that is addiction in terms of power. When this guy has not done his job, that's what we're dealing with. And you can see the power. Now let's just look at emotions itself. You could argue that anxiety is like a chronically stimulated amygdala response. You've got that button pushed on a regular basis. And we already know in psychology for sure that you don't have to actually be afraid of a real thing. It can just be a perceived threat. If you're frowning at me, I don't really know why you're frowning at me. I don't really know, but I can imagine all sorts of things. And the moment I start to imagine all sorts of things, my amygdala is getting pushed. Because I can't, that part of my brain is not the part of my brain that knows that's not real, that's just fantasy. It's just recognizing danger, they think I'm stupid. Oh no, that means what? Oh, I don't know. And I'm going to have that amygdala response. And so one of the treatments of anxiety is something like cognitive therapy. What are the thoughts that I have that are driving me to push that amygdala? Unintentionally, of course. Half the time we don't even know what we're thinking. That actually requires a certain level of sophistication to recognize your thought. Remember, that's that frontal lobe, and a teenager is just learning how to do that. So if you don't even know what your emotions are, you've got to learn that first. Okay, so that's anxiety. Now let's bring this to drug addiction. What feelings do cravings bring? Is that a good feeling or a not good feeling? And if you had to actually tie an emotion to it, if you actually had to use an emotion like happy, sad, angry, anxious, anxious, right. And here's a picture of a PET scan that shows us in that context of, we're looking at a slice of the brain, a part of the brain, the person's alive thinking, and where is the body actually, or the brain actually using more oxygen, therefore that part of the brain is working more. So we can see where it's working more. This person's watching a nature video. There's the part of the brain that's using that part of the brain to watch. And the amygdala we know is right there, and it looks the same. It's there. It's interested, curious, kind of watching, making sure everything's okay. That's not really happening to me. It's just on TV. And then here we have a cocaine video. Not even the substance in their hand, not even using it, and look at that amygdala, right lit up. That's like probably as bright as it can get. That is an elephant that has kicked off the frontal lobe. That is an elephant, that is a person who's operating now from fight, flight, freeze. Translates to thinking, it's all about me. Right now, and I have to have it or else. There, that's what's happening right there. The mobilization of the body has gone to that part of the brain, and that's exactly what's happening. So you get this phenomena here, limbic system on that poor frontal lobe who cannot possibly compete with that. Cannot possibly compete with that. Now, of course they can. We can always choose whether to pick up the drink or not. Of course we can. But the amount of endurance that it takes to do this, if you're constantly in a situation where the craving hits, is extremely difficult. There was some recent research done on a term called frontal lobe fatigue. And what it was actually arguing was, at a certain point, and we all know this intuitively, at a certain point, your willpower just gives up. And that can happen even in the course of just an afternoon. The willpower just deflates. And they were suggesting things like if you eat some sugar, you'll actually boost it up again. I'm not going to suggest that you do that, because I think sugar actually can act like a drug too. But just if you actually give it some nutrition, you can actually support it again. But eventually it gives up. So it is true that some people can be better at willpower than others, but we're talking about something that is significantly stronger, and even the best of us will eventually fail, because we're not wired to have this thing looking like this. Okay, so the person may often stop using just to, not because they want the euphoric feeling, but just to stop the feeling of anxiety. And you'll notice that a lot of recovery techniques are anxiety management techniques. They're anger management techniques. They're all kind of the same idea. Don't get into the situation to start up the elephant to rear its head like that. And then when you are, recognize that you're dealing with an elephant, and then you start doing techniques to avoid or to basically subdue the elephant. And I'm going to say something here that's, I think, really important in terms of recovery techniques. That at this point in time, when you are trying to deal with your emotion, whatever it is, whether it's craving or anxiety or anger, you have to, what you're trying to do is support a frontal lobe response to the emotional brain's perception of threat. And the emotional brain is much bigger. However, that is a counterintuitive strategy to that middle part of your brain, that limbic system part of your brain. And that's really important. As I'm standing there in the middle of the road and the car is coming to me, my recovery counselor is coming up to me and saying, "No, Vera, I want you to stand there and question him. I don't want you to get out of the way." I don't want to do that. I want to get out of the way. Excuse me, there's something wrong with this picture. No, I'm not. I'm going to get out of the way. But what we're trying to do here is, with addiction or any kind of management of this sort, is to say, yes, I know it appears that way to you, but your frontal lobe is not working. You can't see the larger picture, and I'm actually going to ask you to do something that will be counterintuitive. Like, for example, instead of throwing the phone down, count to 100. You know, instead of sending off the email, to go for a walk first. Instead of calling my dealer, call a sponsor instead. I don't want to do that. I want to do this because this is what I know I need to do. No, but we're asking you to do something else. And a lot of it is just a matter of managing 20 minutes. Because when you have that amygdala response, that panic response, how long does that last? From the time the child sees oh, it's just a cat, and meanwhile they're already terrified. From the time they recognize frontal lobe recognition, I'm safe, it takes about 20 minutes for the whole system to demobilize, for my blood pressure to get back, my breathing to be okay, my thinking to be not about me and right now, but oh, you know, if I do this, then this will happen, and you know, maybe if I just connected with somebody else, all that kind of stuff takes about 20 minutes. So you need to have in place almost a counterintuitive strategy, something you don't want to do for 20 minutes, and then you will want to do it. Because we all know that, thank God I didn't send that email that I went for the walk. Or I wish I could find a way to get that email back from cyberspace. You know? And it's just about that 20 minutes. And a lot of recovery techniques are about that 20 minutes. And one of the things, too, about this middle part of the brain, this emotional piece, is that it's not the part of my brain that has a very long time span. It knows it's only about right now. It's not about tomorrow and yesterday and the next day. That's my frontal lobe. It's about right now, I need this help right now. So I need to have techniques that are essentially techniques for right now. And you'll notice, again, in a lot of recovery techniques, including the 12-step program, it's one day at a time. And in fact, it's not even one day at a time, it's sometimes 1 minute at a time. Right now, do I absolutely need to use this substance? Right now. I mean, I might in 5 minutes, but right now, do I? And if you can answer the question no, okay, you're good for another minute. You have to have those techniques, and they have to be very time-based to right now. Again, another reason why having an intellectual understanding of addiction is of no use at all. Because you notice a lot of these things like calling somebody, putting off, distracting. I think I have some suggestions here. Distracting, affirmations, counting, calling. They're not intellectual. We don't want an intellectual response. We want something for that stupid animal part of us. Essentially the 3 or the 5 or the 6-year-old in us. If I go into a grocery store with my child and the child says, I want this and I want this, I'm not going to say, no, you know what, George, here's the 10 reasons why I can't give you this because of the teeth and you're going to get whatever, all these reasons. You're just going to say kindly, no. You might distract. You might say, you're a really good kid and we're going to look forward to something else later, or you're going to do something that's very non-intellectual. And you may hear it in the treatment centers and in the rooms that you can be just too smart for your own recovery. Because you're focusing too much on expecting your intelligence and willpower to do this stuff. And this stuff is not intellectual. One of the things that I really like about, but you can see it is not something that people like when they first come into a treatment center or even like a 12-step room, like an AA room, You see the slogans, you see these silly little 3-sentence things, and you go, oh my God, excuse me, I'm a little too intelligent for this, But the point is when you are in that limbic, heightened, aroused state, all you get is 3 words to understand. Remember that chimpanzee ape? It gets about 3 words. You can't do the Psychology 101. It is of no use to you then. It's like that, oh, what was that word? What was the name of that researcher? I couldn't remember. It's there, but it's not useful for me right now. I need to have the easy does it. Let go. Call a sponsor. Whatever it is. I need that I get. And it's concrete instructions that are very time-specific to right now, and they're very short, clear, usually positive as opposed to negative. Like, for example, why would this not be a good one? Don't. It's very short. Does this give you a soothing response? No. It's just going to essentially re-traumatize that part of you. Oh no! And then you want to find another way. See, you actually have to find something that's, the mother who's saying no to the kid in the grocery store doesn't want to be yelling at the kid, because the kid is just going to get more and more emotionally aroused. You want to give the kid safety and also a distraction. So that sort of thing is not a good idea. So simple instructions and distress tolerance, essentially. Now, we see that term distress tolerance in a lot of emotional mood management, that term distress tolerance. Learn how to tolerate distress. For example, this too shall pass. It's happening right now, but it shall pass. Non-intellectual, and that's a really important piece to get. Okay. I mentioned about the frontal lobe fatigue idea about willpower falling apart not too far away. And in this research, they were actually suggesting things that you might be interested in. If you want to exercise your frontal lobe on a good day so that it's ready for you on a bad day, just try and not swear, for example. So what you're doing is you're learning how not to be so impulsive. That part of you is saying, no, I'm not going to do that. Don't say I in every sentence. Another example. Writing with your non-dominant hand. These are all just examples of ways to almost like work out your frontal lobe. In the recovery program, a lot of the techniques that we teach, like prayer and meditation, in the morning you do some sort of a ritual. These are all ways to exercise that frontal lobe. Think about people use that kind of terminology as, it's my morning discipline. It's my morning ritual. I don't always want to do it, but I do it. In the same way as I don't always want to do exercise, I don't want to be a couch potato. I want to be fit physically, so I have to exercise, and I want to be fit mentally, so I have to exercise, in whatever way that is. And people will say, spiritually fit. But it's something that you have to do, because we all know that with exercise, how long does it take if you stop exercising before you're back? Not a long time. And the same mentally. Because that part of the brain is very, very focused on day to day to day. So if I've done something that day in terms of a morning ritual, when something bad happens later, it's not that far away. But if it was, 2 years ago that I learned this in my class, that's a long time ago, and it's become intellectual. Okay, so that's the emotional piece of the limbic system. Now, so in a sense, that's I do things that my fear and my anger will, or the lack of them, will dominate or determine what I do. The other thing that the limbic system does, and I would argue is even more powerful than emotions like fear and anger, is our reward pathway. I mean, I could ask you, what is more motivating, fear or pleasure? How many people would say fear? And how many people would say pleasure? Okay, so more people say pleasure. Okay. Sometimes a lot of people will say fear, and I would ask them to think about. Well, I'll just let that one go, because most of us are saying it's pleasure. But fear is very motivating, but it is probably the case that pleasure is slightly more motivating. And certainly you can have people on different ends of the continuum, But for the most part, it's more motivating. Because if I'm an animal and I want to forage out for food, I certainly want fear to inform me that that's a dangerous place to go and that one isn't a dangerous place to go. But if I've had one bad time and it was bad enough, I'm not going out anymore. But the pleasure and in the hunger may not be enough either. But the pleasure of wanting to go out, the pain of actually staying in and being isolated and not eating is so great that I will go out anyway. My desire to seek out some kind of pleasure to get away from the pain is stronger. So I think the argument could be that reward is slightly stronger. In that same part of the brain, middle part of the brain, limbic system, we have right next to the amygdala, which would be right around there, we have this other organ that's called the nucleus accumbens. And if you're interested in anatomy, that's the other one that you really want to get, especially if you're interested in addictions, nucleus accumbens. This is like our pleasure button, sitting right next to the amygdala. And this informs me that I'll eat not only because I'm hungry, but because it really tastes good and I want something that's energy dense more than not. That part right here. And just like with the amygdala, this will kick in first, and then seconds later, the prefrontal cortex will kick in up there. This first, then that. So we have the phenomena that you may have read about in books like a book that came out a while ago called Blink by Malcolm Caldwell, where you make a decision when you go into a store, for example, you've already bought the item in your head. You already know what you want. And that the job of the salesperson is really not to convince you to buy it, because you've already bought it in your head. It's to help you talk yourself into it, because you want to buy it already. And then you're going to try to talk yourself out of it, that reasonable, rational part of you. But the salesperson is going to be on the side of the limbic system saying, no, 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 you really do want this, and here's why. So that's nucleus accumbens. So just to remind you, like with the pain thing, it's there to support our life-sustaining activities. So the biological purpose of the natural reward system is to keep me alive. It's the reason why some things, like I don't want to eat a piece of wood, because a piece of wood would do nothing for me. I would entirely digest, I couldn't digest it at all. It would hurt my body, and so I would have no desire to eat it. Whereas I have a high desire to eat sugar because it's energy dense. So what are some natural rewards that we have? These are natural rewards. Anybody? Pardon me? Yep. Eating, procreating, there you go. That's already two big ones. So eating, we've already mentioned, procreating as well. Sexual behavior, it keeps obviously the species going. It keeps the two opposite ends of the species, male, female, for the most part, together. It has its own reward factor. We have a few others. Safety, the importance of safety. We all know that really by its absence. When you're not safe, you're anxious, and that feels really unpleasant. But also, when you're safe, it's a feeling of, it's a good feeling too, very good feeling. And a lot of prayer and meditation is about building that feeling of safety, almost like an antidote to anxiety. Positive emotions like companionship, love, and joy. Are those important for our survival? And you could argue that they're not as important as sex and food for our survival, but we already know that if a person is depressed and is unable to enjoy love or joy or companionship, people, they can't enjoy food, they can't enjoy sex, they can't enjoy anything at all, they want to die. I mean, suicide risk is extremely high. So the negative of companionship and love and joy is extreme pain, but also the positive. You think about companionship, the social context. We are social animals, and our brain has developed primarily in the social networking context the most. So, because we are far too fragile on our own. So these are reward pathways that are oriented to making us feel good. And one of the things I'll say before I get into what addiction does with this is to say that when we talk about recovery, we're talking about we want to recover these natural rewards. We don't want to not feel happy again. We want to feel happy in the way that our body is meant to be happy in these ways. So we're trying to recover our natural reward pathway. Because what's happened with addiction is you essentially have, let's just go back to that picture here. This part of the brain, middle part of the brain, which is stronger than this already, what essentially happens is this powerlessness that I am over, I don't have any power over this. What addiction does is it takes a red line and just circles that even more, so that you really are more powerless than ever. How does it do that? This way. You've got the rat here, and this is a very happy rat. And what it's doing is it's got a green substance that's wired directly to that nucleus accumbens. So it's getting some kind of a hit of a chemical or electrical charge, it doesn't really matter what, to that nucleus accumbens area. The more it taps, the more it gets. The faster it taps, the faster it gets. We have natural rewards like a mate, just over here somewhere, cheese, and it's hungry, water, and it's really thirsty. In fact, it's so thirsty that a glass of water would be delicious because it's going to die if it doesn't drink today. So a glass of water is going to be really nice. And what would it do if it can? It'll keep tapping the bar to the point of death. It'll tap the bar even though the water is there and it's going to die. Why? Because it's according to that rat brain, that middle part of the brain, not the thinking part, of which there's probably not much anyway, but this part of the brain here, it doesn't know what's happening. All it knows is I'm getting a lot of this. As far as it's concerned, it's getting tons of water, tons of sex, tons of whatever other pleasures there are, all at once, right away. Why would it bother with all this slow diluted when it can get it all at once? So the principle here about addiction is anything that is more intense and concentrated and immediate is going to be more compelling to this part of the brain. So if you get something that is intense, like this much as opposed to a little bit here, and you get it right to the brain, like direct, basically quick fix, quick hit, right to the brain, that is an energy-dense experience that the rat is going to choose over something else. So addiction is taking our already fragile or weakened part of us and just underscoring that. Because what we have with the drugs and alcohol are refined products that have been manufactured to give a bigger reward than the reward that our body normally expects. And it's manufactured to do it much more quickly. If I eat something, it takes over 20 minutes to register. Whereas if I have something that's going directly to the brain, that's right away. And we know that, for example, when people are doing something like cocaine and they're snorting it or injecting it, that's pretty fast. It's a lot faster than digesting. Like they used to chew cocoa leaves. Addiction wasn't as big a deal then, although it was still pretty powerful. Because they chewed a lot, apparently. Big wads of it in their cheeks. But when people went from sniffing it or injecting it to actually smoking it, which is the fastest to the brain, that's where you saw functionality lost. Totally lost, because that's going even faster to the brain, so potentially even more addictive, or more quickly addictive. Alcohol is digestible, so you can be a functioning alcoholic for a long time before you've crossed the line, whereas you don't see that happening so much with the other drugs. So that's that concept of immediacy and concentration is it doesn't even matter what the substance is. It's just that phenomena itself. It's like the pharmacokinetics, if you want to call it that. Make it such that you have something that overpowers our natural rewards. And it overpowers my natural ability to say no. If somebody gives me a glass of water because I'm really thirsty, it's delicious. And then they give me a second glass, and that's nice. And then they give me a third glass, and they say, but Vera, you really liked it, so have another one. I say, you know what, actually, I don't want any more. Okay, I'll have it just because you're bugging me. And then fourth glass, and I'm getting mad because it's starting to hurt. So there's a natural ebb and flow of what I want because I need, and then when I don't want, I don't need anymore. And I can only drink so much water. Before I will either feel sick enough to stop, unless I'm taking some medication where you can kind of push it over. But generally speaking, there's only so much that we're willing to do to ourselves for the pleasure. So natural ebbs and flows that exist in a natural reward system. And you could almost argue that the definition of addiction is when that is gone. When that is gone. So the person is now saying, I am full, I don't really want to eat anymore, but I'm still compelled to eat. And so I'm going to throw it up. And we've got a binge eating disorder thing happening, which I could argue is a food addiction. Something has happened that my normal, natural ability to say no has been overpowered, because this is unnaturally, it's like my body, the rat part of me, is unable to regulate that. It's just too big. I like to see this almost as the, in the biblical terms, as the original sin, that knowledge that you weren't supposed to have. I don't know what to do with this. This is beyond what I can deal with, drugs and alcohol. That elephant is used to, the stress of life, but this is like just even more than, the balance between the frontal lobe or rationality and emotionality, which is precarious even for being a human being, is totally blown out of the water when we're talking about addiction. We've introduced an artificially overpowering substance that's already enhanced our weakness, even more so. So you can see why it's so difficult. And by the way, you can see why it's almost impossible to deal with addiction alone. Because when you're alone, you're working on willpower, and that's that frontal lobe. And you can really, you're putting you're hedging your bets on the wrong team, basically. You want to be working with techniques that deal with this. So that's the sort of essence of addiction. So drugs hijack that reward pathway, overtaking it, because they're more intense and more immediate. And no matter how important those natural rewards are, like family, job, housing, they cannot compete to that rat brain part, which just recognizes now and that immediacy. And I want to suggest to you a concept here about how to view addiction or drugs and alcohol. And it doesn't even have to be drugs and alcohol specifically. It can be some behaviors too, like food, sex, gambling. Concept of post-traumatic stress. Now we know the concept of post-traumatic stress when we think about fear. Something really horrible happened a number of years ago. I saw my buddy blown up in Vietnam or something like that. And now every time I hear the sound of something, I'm there, And my brain, that rat part of my brain, has done that intentionally because I saw something so horrible and I want to hear everything and register everything so that if I'm ever there again, I'm going to be out of there. I've registered. I will be alive, whereas the person who hasn't seen that again will be dead. So post-traumatic stress in that context is a survival mechanism. And I want to suggest to you that addiction is like a post-traumatic stress of the positive, except it's not positive. I saw something that was so beyond normal, good, and now that rat part of my brain has registered that too. The day has been a long day, and my whole day is spending to get food, and because I'm an animal, and foraging, and my nest, and all. It's a whole day of It's a whole day to stay alive. But I come across somebody's stash and it's like, wow, remember this. This is a lot less work for me. It's here. Well, that is the stash that I found, and I'm going to remember that the next time. That's called operant conditioning, for those of you who are interested in psychology. You know, we do things and we learn by positive reward or negative reward. Well, I'm going to remember this. And if it's a big remember, I'm going to remember that even more. So you've heard the term, once a pickle, never a cucumber, for addiction. Once you got that knowledge, you're not going to forget it. So if you are somebody who has had that knowledge, or the forbidden knowledge of the Bible, if you want to see it that way, you're not going to forget that, because it's outside of the realm of normal experience, and that rat part of your brain has registered, I like this, and it's always there to come back to. And luckily that naive person who didn't know any better doesn't know that, and if they've never known that, they won't get your dilemma either. So, you know, once you're a pickle, you're always a cucumber. And I think if you use that concept of the post-traumatic stress and the impact of that we can see on negative, well, let's just see addiction in the same way, but on the reward side of it. Okay, so now let's look at the actual drugs themselves. Here we are looking at the nucleus accumbens, and we know that with SPECT scans and PET scans that cocaine, heroin, alcohol, even smoking cigarettes goes to that nucleus accumbens. It's already there. I was arguing the concept of intense, immediate concentration of reward. It doesn't even have to be a substance. So we can have food, sex, and gambling. Food could fit down there if we're talking about specific foods like sugar, or even just eating behaviors, binging, purging, sex, and we're talking about anything where you're getting an intense, concentrated, immediate. And where do you see that with sex? But porn, internet porn. Gambling. Gambling, what is gambling? Gambling is just simply I'm hedging, I'm just curious about what's going to happen. Something good might happen or something bad. Now that's normal life. I get out, I wake up in the day and I'm curious about what's going to happen. But what gambling does is it takes that natural reward of curiosity, which is a very powerful motivator for us, and enhances it and gives it immediacy. So I go into a gambling casino, and right away when I push the things, I find out, am I going to get it? Yes. Right away. Next, next, next. And then the stakes get bigger and bigger and bigger. And so you can see there's that intensity and that immediacy that creates what would be a normal process into what we now call a process addiction. So you could argue, well, anything can be addictive. And I would say, yeah, it probably can. And I want to show you how that actually works in the neurochemistry. But I want to just take a little segue here, because I know that some of you won't be here this afternoon, that absolutely anything can be addictive if you have gone beyond that ability to say yes and no, the normal ebbs and flows of our control. Just in the last couple of months, the American Society of Addiction Medicine has come up with a new definition of addiction. And actually, it's the first definition of addiction. We've never had one before. We've had terms in psychiatry and in mental health and in addictions. We use terms like substance abuse, substance dependency. And the focus has been really on the substances. Alcohol is addictive, cocaine is addictive, marijuana for some reason has not been on that list, food has not been on that list, but so some things are on that list and others aren't. The focus has been on the substance. And how is it that those things are addictive to the brain? But the American Society of Addiction Medicine finally came out, and this is a fairly new organization. It's about 10 years old now, 15 years old, but getting more and more vocal. Came up with the definition to say, enough with this focus on the substance. We're looking at the biology itself, the actual mechanics of addiction. What we used to call the addictive personality Well, let's throw away that term and let's just call it addiction now, because it is in the brain, this part of the brain, and it doesn't matter what the substance or process is. If that part of the brain has been triggered, we've got an addiction. And I think that's actually a pretty phenomenal step, and we'll see more along that line, because it opens the door to the possibility that we can easily substitute. If I put down alcohol, it will be so easy to pick up something else if I'm still looking for the intensity and the immediacy, the quick fix. And I see that all the time in my work at Renaissance and Salvation Army, where people will come in and say, Doc, I can't believe it. Why am I eating 5 or 6 chocolate bars a day? I never used to. And I say, well, what was your drug of choice before? Alcohol? Opiates? Yeah, because you're just substituting. You've got to eat a lot of chocolate bars to get the same effect, and very quickly, but that's what you see with the binge eating disorder. A lot of chocolate bars very quickly. Okay, so it doesn't really matter anymore about the substance. It matters about the actual mechanism. And I want to explain to you the mechanism next. Oh yeah, here's the definition of addiction. Well, let me just go quickly. This is really the definition here. I'm going to talk more about this in the second part of the class. So anything can be addictive, whether it's behavior or a drug, if you have a difficult time to abstain from it. You have definitely said, I want to quit smoking, and then you still pick up a cigarette the next day or the next 5 minutes. Impairment of behavioral control. That you say, I'm just going to have a couple, and you end up having more. You cannot control your behavior around it. Craving. Even if you're not using, you're thinking about it. Diminished recognition of significant problems. It's not, yes, I know I have a DUI, but it's not really, it's just the cop, he doesn't understand it, I'm going to fight it. It's not, you know, there's something wrong with that. It's not really what you think it is. Yeah, I know I have 3 now, but you know what, so I won't drive, so who cares? I don't need to drive. And I've seen people sitting up in my table with end-stage cirrhosis. Their abdominal, their abdomen is bloated out, and they're still saying, it's not that bad. Tomorrow, I'm going to have 1 more drink today because I'm going into the residence tomorrow. So just, 1 more last one, and tomorrow I'll be fine. It's not really going to hurt me, this one today. Absolutely, it will. That diminishing of recognition of problems. And a dysfunctional emotional response, usually the mood instability that comes with drugs and alcohol, or any kind of behavior. The hiding and the denial and all that stuff would be in the behavioral piece, but all the shame that comes with it, the depression, the anxiety, all that stuff. So that would be our new definition of addiction. And you can see it could be any substance at all. Now, recovery, let me see. I'll just say about this here, because I'm going to spend most of the afternoon talking about this, but just, really this is just to highlight to you that I've explained to you that addiction is a hijacking of our natural reward system, and what we want to do with recovery is get rid of the hijacker, number 1, and recover our natural rewards. So getting rid of the hijacker, number 1, is, what do we call that? Abstinence. Absolute abstinence. And if we think that it's no longer matters what the substance is, it's the dynamic itself. If somebody comes to me and says, okay, doc, my problem is cocaine, but I don't have a problem with drinking, so, really, that should still be okay. I'm going to say no, because the dynamic is still the same. You're going to substitute, or just go back to the initial drug of choice. Abstinence is the key piece. Fellowship is another key piece. That's the one of the reward pathway of social connection. Prayer and meditation, another one, and that's another reward pathway of safety, essentially. I'm just going to jump ahead because I want to talk about this, the concept of abstinence. It's really worth taking a minute. the elephant never forgets. You know, we use the concept of the elephant or the image of the elephant. Well, remember that the elephant never forgets. It never forgets there was that stash, like I said before. Operant conditioning, this part of the brain is about if I want to do something and I get a reward, I remember, or if I get pain, I don't do it anymore. Now, we know with operant conditioning a few things in psychology that are useful to know. If I want to train my dog to jump, I give it a piece of meat when it jumps. And then the next time it jumps, I give it a piece of meat. But I figure out pretty soon that I don't have to give it a piece of meat every time it jumps. I just do it every once in a while. In fact, I can probably stretch it out to every 20 times. And then if I do that enough, every 50 times. And there's a certain point that I can keep doing it until the extinction is such that the dog is not going to jump anymore. I don't know what it is. I think it's a dog trainer would know better than me, but probably 300 or 400 times. It's a long time, though. If I want to train that dog to jump and not have to worry about how many times has it been, I can use something called random reinforcement. Just whenever I think about it, I'm going to do it. The power of random reinforcement is the most powerful way to train somebody. So that's the essence of gambling. I sit down, and I'm not going to do the 200 times. Okay, it's in 198. Do I still have money? I'm going to do it up to 200. It could be the next one. And if I get up now, it could have been the next one. So I'm going to keep sitting. It's that, I don't know when, but the next one might be it, is the most powerful one of all. So if you're clean and sober, and then you decide, well, if there's a little bit of a window, like when it's my birthday, I might have one, or New Year's Eve. Well, that part of my brain, dog brain, has registered, okay, I'll just wait. And it's, okay, it's not your birthday, but it's somebody else's birthday. And you'll find something. Or you might register on some internal level when I have a certain level of emotional distress, like I'm sort of like certain level of anger, like my body's getting warm and hot and tense. I register, that's when I use. This isn't an intellectual thing at all. This is entirely non-intellectual. I've just reinforced that that's when I want to have I have a craving and want to use again. And if I just use whenever, wow, I've just trained myself even more to at least have cravings. Now, so you can make the argument that you can train yourself to be an addict. I mean, we're excellently trained addicts because just think about the addiction of smoking cigarettes. You know, how many times does a person smoke a cigarette in a day? And every time they take a puff, they get that hit of nicotine right away. So there you go. There's an immediate connection. Operant conditioning. So if you want to be clean and sober, you're going to have that abstinence long past that, what we call the extinction point. Long past that. I don't know what that point is. And if you've done the random reinforcement, it might be a long time. I like to use this as an example. My dog, I want to train my dog because I wasn't paying attention, I trained it how to jump now whenever I'm eating steak, because I must have given it some steak one time, and now it's jumping. When company comes, I get really upset, and I say, dog, you got to stop, don't embarrass me. So I give it some, so it knows, okay, great, when there's company, I get some. And then when I'm really upset, if it whines enough, eventually I'll give in. Good, I'll just whine. Can you recognize how we do that to ourselves? I'll just make myself really mad. I'll find a reason to get really mad. But my dog will never, ever, ever, ever go to the fridge door and beg the fridge door. It'll do it when I'm coming there and it whines and there's company, because it knows then the fridge door will open. But that fridge door will never open by itself. Abstinence is that fridge door. There is absolutely no way that fridge door will open. I'm not going to bother investing anything into that. So the concept of using here and there or for particular things you can see is not as powerful as that fridge door. Okay. I always like to take a moment, breather. I'll do it with you here too. This is a question for the audience. Which dog is cuter? This one or that one? And those of you who know me know what is the right answer. That one. The dog who taught me about the fridge door. Okay. Now, I'm going to spend the remainder of the time to talk about the neurochemistry. I've talked about the sort of concepts of addiction and the large part of the brain and macroanatomy of the brain, gross anatomy. And now we're going to look at the microanatomy, the nerves, and the neurochemistry. And this will explain the concept of addiction. How it is that this thing becomes so powerful and underscores an already weak part of our nature. So when we talk about the neurochemistry, we need to know a little bit about the nerve itself, the neuron. So the brain composed of many, many, many trillions of neurons, the main cell of the brain. And the main cell of the brain, the neuron, looks like this. It's got a head, nucleus, the tail, or the body rather, or the axon, and then the tail, or the dendrites. And certainly, in the brain, we have many, many different types of nerves, so that this could be a sciatic nerve starting in the brain, going all the way down the legs, 2 feet long or so, or it could be just a tiny little thing that's connecting one nerve to another. But they're more or less looking like this. And how it works is the brain, I mean, it's composed of millions of neurons, and how they actually work together is through the neurochemistry. So one nerve doesn't do everything. So if I want to move, I have to think about the movement. That's a brain function. I have to do the movement, and then I have to coordinate the movement. So it's already 3 different parts of the brain. So that's already 3 nerves that are telling me how to move. And really, truthfully, it's probably 3,000 to the 10th degree or something. I don't know how many numbers, but many, many nerves. And how each of those nerves communicate to that concerted effort of walking is through the neurochemistry. So here's a nerve communicating to another nerve. And what it is we have this head of the nerve here that's sucking in a certain amount of neurochemical from another nerve, which is the message, as it were, the neural message to say move. Let's say this is an action of movement. The electrical movement, I'm moving. Now I want to communicate to coordinate. I release some more chemicals, and then I allow myself to do the coordination. So it's a sequential, kind of left brain thing, sequential, one to the other to the other. And now it's probably like a whole bunch of nerves here connecting with a whole bunch here, but the idea is that it's a sequential pattern. And the actual coordination, or pardon me, communication is the neurochemistry right here. This tells me what tells this nerve what to do. Because sometimes nerves can have different functions, so they'll have different, essentially what we call receptor sites, which pick up different messages. Neuromessaging, we could call it neurochemistry. So let's look at the neurochemistry that we're interested in with addiction. These are our happy chemicals. Remember the natural reward pathway in that limbic system, nucleus accumbens? Already there, addiction has enhanced that and has hijacked this. So let's look at the normal. The normal, there's actually more, but this is, if you get this, you got about 80% of addiction. If you got this. 80% of just being mood disorders. Because the theory of a mood disorder, like depression, for example, or even anxiety, is that there's a neurochemical imbalance of these. I don't have enough of these, or there's just somehow an imbalance that I've come to the table with naturally, and therefore that needs to be rectified. So, serotonin is our natural neurochemical that makes us feel, does anybody know?
Safe.
Yeah, safe. It's not the excited thrill, it's the safe, calm, it's good. I'm chilled. No, I don't want to go on Black Friday and go shopping. No, I'm good. I got enough. Thank you. If you want to get a natural serotonin high because you're feeling a little low, fellowship. You connect up with somebody. Go to a meeting. Have you had that experience? You're feeling not so good, go to a meeting, you feel really good. You got a big hit of fellowship. We are social animals, and we are primed to generate from social connection. And for the introverts in the crowd, probably you're an introvert and you're getting your social connection from reading and the internet and stuff like that. It's still social, even though it may not be one-on-one face. Because the worst thing I can do to somebody is isolate them. Besides kill them, isolate them, humiliate them, embarrass them, ostracize them, ignore them, abandon them. Those are horrible things to do, and it's all serotonin. So a natural way to get a serotonin high, a social connection, and you know, something good. Another natural way to get a serotonin high would be an appreciation list. You're going to notice these are recovery tools that we learn in the 12-step programs and in recovery treatment centers. I don't want to do an appreciation list every morning, but I'm giving myself a serotonin high. And if we follow the belief that some people come to the table, in a sense, with an under-diminished appreciation of serotonin, and therefore they're more likely to become addicted, and that's what we do seem to see with addiction, that people, you know, we talk about the biological disposition towards addiction, it's because there may not be the sufficient amount of response to serotonin in the normal life that another person would have. So I can either get that through medication, hopefully if it works, or I can do it through behaviors that I'm going to have to do a little bit more than somebody else, like an appreciation list and fellowship and all those things we learn in recovery programs. I'm trying to think if there's another one. Well, it might come to me. Dopamine is the natural neurochemical that makes me feel excited and thrilled and looking forward to things. It's the curiosity. It's the thing that I'm using when I'm playing gambling and I want to see if I'm going to win or not. It's the thing that makes me feel good about myself, and aren't things just wonderful? It's the excitement. I'm looking forward to going to Cuba next week or something like that. It's the ritual when a person is about to engage in a drug use and they say to me, Vera, it's not the drug I want anymore, I miss the ritual. It's the dopamine, it's the anticipation of. Now, the drug of abuse that hijacks dopamine, can anybody guess what that is? Yeah? Sorry?
Cocaine?
Yeah, that's right, the stimulants. Cocaine. Cocaine, methamphetamine, crack, the stimulants. Do that. And then the behaviors like gambling, like crisis seeking, like, I think, extreme sports. You know, I'm going to jump off this plane and I hope that the parachute will work. I assume it will. But there's that little bit of thrill. That sort of thing. Endorphins are our natural neurochemical that makes us feel, that's our natural pain mechanism, our pain anesthetizer. So when I hurt myself because the saber-toothed tiger is chasing me, first of all, my nest and my warmth and my safety is the serotonin. I had to get up and look for food, that was the dopamine, and now I'm out and I've twisted my ankle, the saber-toothed tiger is after me. I'm able to run and get up and I don't feel it and I feel even more energy, and I'm off and I'm saved my life. I get a flood of endorphins that allow me to feel no pain physically or mentally, numbing of pain. And I even feel good, kind of connected, and I'm like overpowering and better. For the time that I need, the 20 minutes or so until I'm safe. And what's the drug of abuse on the street that hijacks this? Does anybody know?
Heroin.
That's right, heroin and oxys, even bigger than heroin now, OxyContin. So any of the opiates, the Tylenol 1, 2, 3, 4s, the codeines, Demerol, morphine, oxys, heroin.
What's the natural?
Well, good question. So a natural way that we get that, besides pain, and by the way, what's a positive spin on pain? Exercise. People talk about a runner's high. Would you actually get up and run if it hurt as much the next day as you're doing it? I mean, when you think about actually what exercise is, we're not talking about the mild exercise. We're talking about the hard workout. where you're actually tearing little muscle fibers that hurt the next day. Oh my God, I can't believe I pulled all those muscles. But at that particular time, you're actually getting a little bit of a buzz, just enough to get you to do that so that you'll build that muscle mass. But not too much, because then it'll hurt. But there's just a zone, they call it a zone. And that's actually a natural way to get endorphin high. Sex is another way, endorphins. The actual sexual orgasm itself will give a flood of endorphins. Prayer and meditation, another one. Now there's a recovery technique. Cursing, not a recovery technique, but we think is an endorphin, a little bit of an endorphin, because you stub your toe and you swear and it feels better. I'm going to argue that things like women who, it's usually women, not only, but usually men, well, tattooing is one. And I've actually had people say they like the experience of tattooing. It's an endorphin high. What I was about to say was people who cut and slash, hurt themselves, self-mutilation. Are they doing it to kill themselves? No. It's to numb that emotional pain. It's an endorphin. And dopamine would be probably more things like developing a curiosity and an interest in things. And it's something that can't be done intellectually. You can't think, I really should learn how to play piano. You actually have to do that, have the experience so that you can then look forward to it. It has to be a lived experience. The drug, I mentioned cocaine and opiates. Where do you think alcohol fits into this? Yeah.
All three.
Yes, all three of them. That's right. Alcohol fits into all three of these. And so here is where the concept of there are many roads that lead to Rome. If you are a cocaine user and you are what we call kindled or primed on dopamine and serotonin, you've had more of it. Cocaine is mostly dopamine and some serotonin. And then you introduce alcohol into the picture because you're not using it anymore, but you're going to drink. You're already 2/3 of the way to being an alcoholic, at least, if not already before. Because often people were drinking a lot before and then they switched to another drug. So the brain doesn't really care how it gets this. It's just getting more of it. And that's the concept of substitution. Now, I want to show you this graph, because this is actually going to show you a little bit of the mechanics that somebody else was asking about, to show you that it doesn't really matter what the substance is. It matters about the mechanism in the brain. So here's a picture of one normal nerve communication and an abnormal. So we'll look at the normal first. So this is in the limbic system. You guys have to leave, eh? Okay. In the limbic system, nucleus accumbens, the pleasure center. The actual experience here, the job of these two nerves is to pass on the feeling of pleasure or euphoria or feeling good, sense of reward. So in the normal course of a day, let's see how that works. So in the normal course of a day, I wake up in the morning and I'm looking forward to the day, and I read the paper, and in order to have that experience of enjoying the paper, I have to release a few dopamine to keep that charge going of feeling good. And if I don't have enough dopamine because I'm depressed, I have either a deficiency of dopamine receptors or of actual neurochemicals, then that's why I'd be depressed. That's the theory. Okay, so this is normal, and so I'm having that. Then lunchtime comes, and I meet up with a friend, and I release more dopamine as I talk, and I'm interested in what they have to say. And then dinner time comes, and I go to a movie, and I release lots of dopamine and have a really good time at the movie. And then it's 1 o'clock in the morning, and somebody says, Vera, will you want to come out? It's the film festival. There's a really good film. You want to come out now? And I'm likely to say, because I'm over 40, I'm likely to say, what? No. I'm depleted. I'm running on empty. I'm out of resources. I could go, but I'll be crabby. I could say, I'll go, but I have no more dopamine left to enjoy the experience. I'll be depressed. I just won't enjoy it. I'll be there, but I won't want to be there. Let me spend the night and replenish my resources so that I'll sort of fill up over the night, get my resources back, have a nice good sleep. I won't do as much in the day and the next day, so that by evening time I'll have lots to enjoy the experience. So this is the idea here of the normal ups and downs of life. In the morning I'm full of energy, and at the end of the day I'm tired and I don't really want to do much. Normal. And serenity is not about flatlining, it's about having those normals, and actually and our body, our psychological body, can handle those ups and downs. We're good with those. We can't handle these, no, but these we can handle. So the normal ups and downs, if I had a really busy day yesterday, I might be a little bit down today. Ever had that experience where I don't know why it is that I was so happy yesterday and today I'm not? It's because you probably were really coasting on your dopamine yesterday, and you got to sort of give yourself a day or so to catch up again. And when we talk about meditation, often it's about learning how to live in a moderate realm, so that when you're up high, you bring yourself down, actually learn techniques to make you feel a little less happy, or bring yourself up. So that's normal. Now, what drugs and alcohol do is, through a mechanism, they will fool your brain into letting, instead of a little bit over the course of a day, all at once, that happy feeling. So there's what you should be getting steady over the day. You get it all at once. Now that's that post-acute traumatic positive. Wow. That our body can't actually handle that. We can handle this. This is a little too much. And here's the, now I'm a pickle. But, okay, that's fine. So I'm going to register that in that operant conditioning way. I'm going to register that as something that I now energy dense. I'm going to keep doing that. But also, even at the time, what happens here? I've got nothing left. Now, the reality of it is of course I have something left. I don't clean it all up in one go. But I've taken a lot more than I should have here. And so now I'm down here, low, and I'm lower than here even at the end of a day. So I'm going to want to keep trying to squeeze out whatever I can, because this low is much lower than this. I don't want to feel that low. I mean, how many times do people say, I'm not even using now to feel high, I just don't want to come down. I just don't want to feel the next, the next minute. I want to just keep trying to stay afloat, because this place here is extremely painful. Much more painful than our body can handle. So the point I want to make here is, you're not getting high off of this substance here, in this case cocaine. All this has done has allowed you to get high off of your own dopamine all at once, or more at once. So that's why this can read cocaine, shopping, sex, sugar, whatever. If it does that, it creates that intensity and immediacy, then you've got this addiction paradigm, and then you've got to deal with this empty feeling. And everybody knows who's been in an addiction cycle that at some point you stop because there's just nothing left. You can just keep doing it and nothing comes, there's just nothing left, so you end up stopping. And then you go into this, withdrawal, a neurochemical process. That guy is the elephant who is saying, I've got to save my life. And, like right now, right away. And my frontal lobe, that's trying to say, no, I don't think this is the right way to do it, and can you please call a sponsor instead and do this and this and this, is dealing with this. That's pretty hard. Now, if you want to try to do this by yourself, what do people say? How's that working for you? It doesn't work for very long. Okay, so I'm going to just jump ahead because we are just about done and just review what we've done. What I've talked about is the large parts of the brain Specifically, the three parts, the brain stem, the middle part of the brain, and the frontal lobe, which is the sort of cap of the mushroom. And that frontal lobe, even though it's the most newly developed, the weakest part of us. Middle part of the brain, the limbic system, where the emotional piece is, and the reward pathway. It keeps us doing things that will keep us alive. It's wired to be more immediate and more powerful. And what drugs take is this bit of me that's I'm already powerless over, and makes me even more powerless because of the intensity and immediacy. And there's nothing magical about the drug or the substance except that it allows that mechanism to happen. So please don't be fooled into thinking that it's the substance. It doesn't have to be. It can be a behavior. And triggers and cravings can activate this because it's that learned operant conditioning. Once I learn that something feels good, that makes sense. That's the dog part of me that knows that when company comes, it gets a piece of steak if it bugs Vera enough. The frontal lobe is delayed and weaker, and therefore you can't do this on your own. That's really the end result, or the end message that I want to give. Now, are there any questions? We probably have time for a couple of questions, and I'm really sorry I had to stop answering at the end there. Yes,
I
please.
was just going to say, like, damage done to the brain
Yes.
from alcohol and drug addiction, is it irreparable, or will it come back, like, slowly, or depending on the usage?
That question has many different facets to answer. It would really depend on how much drinking and for how long. Some of this stuff that I've been talking about has been the psychology of addiction to some degree, and I would say that at some point the damage can be repairable in the sense that if you get past that extinction point of not drinking, cravings should be significantly less. But if you're talking about something like my memory is not as good anymore, or my thinking capacity isn't as good anymore, that really depends on the level of damage on the brain, which you'd have to do by looking at an MRI or something like that. It's definitely true with alcohol that the brain does atrophy over time, and that would be irreparable. But don't take that as negative or bad news, because for the most part, people do recover quite significantly in the first 2 years. Yeah.
Thank you.
Yes.
Like somebody who's using drugs for like a long period of time, 2 years, 3 years, should they get an MRI done from their family doctor?
No, well, if you're in the States and you can pay for your services, sure. I mean, I actually heard just now somebody actually got a SPECT scan, and I was floored, because that's something that we don't even have that here in Toronto, except there's a few handful of doctors that are trying to introduce it. Some of this technology is still experimental, very expensive. To get something like an MRI, unless you have an injury, like you've had a stroke or a seizure, because of alcohol, then you could warrant it. But to just say, I want to see how I am, it's really about dollars. They're going to say, no, that's not worth it, unless you actually have proof of injury. Or you can pay for the actual service, like in the States. Yes, and then I'll get to
you. If you have a tragic event in your life, a dramatic psychological trauma,
Yeah.
that will permanently affect because of safety and security, permanently affect your serotonin levels? Or is it only when you revisit that fear that it may be affected?
You know, that's a really good question. I don't have the answer to that. But what I can say is that psychological trauma will reduce serotonin levels. It absolutely will. Now, whether it's permanent, I don't know the question, but it's a really good question. And it's one of the ways that you can behaviorally manipulate somebody's levels by making something good happen or bad happen. And it's one of the reasons why in therapy, you know, they say you got to act yourself into right thinking. You can't think yourself into feeling good. You have to actually do the actions, get the serotonin, and then you'll feel better. So you can actually manipulate. But whether you can actually damage permanently, I don't know the answer to that. I would guess that some psychologists say yes, you can.
Well,
but
obviously, if we revisit the fear all the time,
Yeah.
keep paying that bill and visiting the fear.
Yes, you can continually keep it going. Yes, that's right. Now, you had a question?
Yeah,
Yeah.
Early stages of dementia.
Yes.
From alcohol abuse.
Yes.
Right? And where does dementia turn into what brain? and the definition of wet brain.
Okay, well, wet brain is a term that actually doesn't officially exist medically, but there are different types of dementia that can occur with alcoholism, and so it would probably fit one of those. I mean, there's the sort of well-known one, Wernicke-Korsakoff syndrome, but it's actually quite rare. What you're probably referring to is the type of dementia that happens when a person is drinking for a long, long, long time. The brain is affected globally. Excuse me, we actually see the brain shrink. It actually called brain atrophy. It starts to shrink. And so that everywhere it's going. But where we probably notice it is in the frontal lobes. Because that's usually where we notice changes with dementia, is in the frontal lobes.
Thank you.
Yes. Is there another? Yes. One of you. I can't really see, so I'm going to let you decide.
When you were talking about the slide about your neuropaths and all that.
Yes.
How does, if you have poor sleeping habits, does that trigger extra cravings for certain?
Yes, it does. I'm actually.
I guess you get your sleep under control, but.
I'm going to actually be talking about that in the second part, the sleep piece and how important that is. But yes, because what it does is it kicks in the stress response, which pushes the amygdala, which then makes you want to self-soothe. In other words, provide that safety. So it does kick it in, and I'll explain it more in the second half. Another question there?
Yeah.
Yep.
Wondering, scarring on the brain, when the scarring on the brain occurs, does that have anything to do with depression, anxiety, and if so, how does the medication help that?
Did you say scarring on the brain?
Scarring on the brain tissue, permanent damage.
I'm not sure. I mean, you can get, like if you have a stroke or something like that, you can get scarring on the brain, and it's been implicated with frontal lobe, right frontal lobe injury could be a cause of some kind of depression anyway. But usually when we talk about depression, we talk about the neurochemistry and the, quote, imbalance of that. It's not so much about scarring, although that can cause it too. Yeah. I'll take one more question and then we'll, yes?
I just wanted to know where food fit in.
Perfect question. Yeah, I do a whole talk on food, but food fits in terms of the neurochemistry. Sugar gets dopamine and serotonin and endorphins. So food is an excellent substitute. Excellent. You have to eat a lot of it and quickly, and that's what we see with food addiction. We see not just a little bit, and the ability to curb the amount is reduced. So it's not only an excellent one biochemically, you can see that, but we see it all the time in practice, all the time. I conspire